I think if you look at this specialized symposium where all the news comes in and out and where people come together to discuss the newest developments, I think perhaps one simple thing you can say to summarize what presently drives asthma therapy. So and also to emphasize what the difference is between asthma treatment and COPD treatment. So while the majority of the patients with asthma that we see in clinical practice usually would benefit from inhaled corticosteroids and or combinations, the majority of those with COPD and even those with more severe disease would practically not very much benefit from inhaled corticosteroids. So that is the latest trend. So for COPD, we would rather first focus on maximal or optimal bronchodilation rather than start with a triple therapy that would also contain inhaled corticosteroids. And I think you have to see it also in the perspective of phenotyping or endotyping that has just largely become a trend in those who do not respond to therapy, both in asthma and COPD. If we discuss novel developments, and I mean in terms of biologicals at this moment are really precluded to those that are not well controlled on standard therapy. And standard maintenance therapy, that means inhaled corticosteroids plus minus LABA, of course. And of course also you need to try and prevent other measures, for instance the irritants like smoking, like allergens, wherever applicable, but also try to look at one's lifestyle, compliance and things like that. Of course that's very important. But for the biologicals it is very important to realize if you engage on a project or on a treatment project of biologicals that you have to take into account that you target the right mechanistic pathway. So you have to find the right biomarkers and you have to define them within a patient and also monitor while you put somebody on a specific biological or targeted biological therapy. So that is also something that we keep on telling our audience, but also we need to emphasize that is quite important, because also biologicals, that is something that you ask a patient's collaboration to come at a very regular basis to the hospital, and also the implications that it has for healthcare and healthcare costs. So that's very important. But the future, if you discuss the future, of course, we are quite thrilled about the new developments in biologicals, in the sense that we have biologicals that target different cytokine pathways, like dupilumab, for instance. That is one name that I would like to mention, because the newest data point towards efficacy in a broader population, and there have been some very interesting data, both coming from lower airways, like Sally Benzel's data, but also from the upper airways, from Klaus Bachert's recent publication on upper airways and the phenotype that has been involved there. And I think it's also very important to emphasize that it's not only eosinophilic asthma and eosinophilic non-resistant asthma, so therapy-resistant asthma that responds or responded in these trials to this development, but also those with less eosinophilia. So that might offer very interesting perspectives, but we of course have to await longer term effects. So that's one thing. And the other thing is also very important to emphasize that during this Congress also the light was shed on the future. So what do we need beyond targeting certain pathways? We also need to extend our vision into what happens before the disease, so the diagnosis, but even before prevention of disease. And that's also something that we need to focus on, and prevention perhaps also comes with application and correct application of immunomodulator mechanisms like immunotherapy, allergen-specific immunotherapy, but also perhaps try other immunomodulators and try to focus on correct developments of these type of agents for the future, and be it peptides, small molecules, or vaccines or whatever. But that is also one of the important parts that we need to try to explore for the future. I think EAACI as a community, I would like to call it a community, is a young community, and there is what we also try to promote is interaction with established people in the field, but also young enthusiastic people, because in fact they are the future and they also are the ones who have to try to find their way within this huge arena of allergic airway disease. And I think for them I would likely have one message. It is very important to collaborate, and collaborate also across your own area of expertise, and try to come together, discuss what you think, and also try to form your ideas and try to give them also a shape by working together. I think that's the most important thing.